and warm welcome to everyone of us joining from across the region. My name is Chinmay Kumar. I'm the coordinator for Asia Pacific Regional Learning Hub by Seven Alliance, and I will be your moderator for today's webinar. So for today's webinar, we will understand sustainability, transition, and co-financing in Grant Cycle 8 through the community lens. Um, our agenda will be unpacking global fund sustainability transition and co-financing rules specifically for our region, and then we will also have a reflection on sustainability models, including limits of domestic funding and community-led innovations. Then we will be having a quick panel on sub-national public financing efforts, drawing from our community speakers from Philippines, Indonesia, and Cambodia. We will also learn about community non-negotiables for STC engagement in country dialogues, and making sure that protecting KP friendly spaces and non-medical services in Grand Cycle 8 accelerated transition context. For our today's agenda, uh, practically our agenda is highly packed, and first we will have a speaker from GFAN AP to set up a regional context. After that, we will hand over to Karon Lama, who will moderate a deep dive panel into regional realities with countries like Philippines, Indonesia, and Cambodia. After that, we will hear directly from Global Fund on GC8 guidance, followed by a presentation on a practice STC tool from NASO, and then we will have a closing. But before we start, we have some mandatory rituals to finish, and this is basically our ground rules. So for ground rules, I will request everyone to please keep your microphone muted, so that all the participants can get the context. Then please type if you have any questions or comments in the chat box. We will address the Q&A session. We will address your questions during Q&A session. Then if you wish to speak during Q&A, please use your raise hand feature. And then we also encourage you to stay present and engaged throughout the webinar. Please note that the webinar is being recorded and it will then be uploaded into our website as well. And please introduce yourself in the chat box. Thank you. Next slide, Karen. To kick us off, we need to understand exactly what is at stake for the communities right now and why it is important. And to set up the regional context and explain why this is important for communities, I am thrilled to introduce Rachel Ong, Regional Coordinator at the Global Fund Advocates Network from the Asia Pacific region. Rachel, the floor is yours and you have 10 minutes. Thank you so much.
Great, thank you so much. And thank you so much for the co-organizers for organizing this really important session. I won't go too deep into the specifics of the SEC policy, as I believe many of you are very and quite familiar with that. But I was actually asked to share a little bit more about my perspectives as well as my reflections around the SEC policy. Karen, are you putting up the slides or should I? Thank you. So my name is Rachel Ong. I'm the regional coordinator for GFAN Asia Pacific, and I'm based in Singapore. The next slide, please. So I wanted to talk about something that sounds a bit technical, but it's actually really personal, because it's about sustainability, transitioning, and co-financing, which many of our colleagues are now facing in the region. Especially for communities, these are not abstract concepts. They are about survival. So let me start by simplifying these terms. Sustainability simply means whether our services continue in the long term, even when donor funding declines. Transition is the moment when international donors step back and national governments are expected to take over. And co-financing means governments must increasingly use their own resources to fund health programs. For community organizations, this raises a really critical question. When donors leave, will our work continue or will our work disappear? And we are already seeing the answer across the region, given the withdrawals last year. So as international funding declines, many governments are stepping in, but often with a narrow focus on clinical services, hospitals treatment and biomedical interventions are prioritized. Karen, next slide, please. 2 slides down. I'm sorry, I should have asked you to move the slide just now. Okay. So meanwhile, community-led services, especially for key populations, are being reduced or overlooked. And this has really serious and real consequences. Outreach workers lose funding, safe spaces close, prevention programs shrink, community-led monitoring weakens, and the very people most affected by HIV, TB, and malaria and other diseases face increasing barriers to access. This is not just a funding issue, it is a structural issue, and it is made much worse by what we often call heavy-handed integration. Next slide, please. In theory, integration is meant to strengthen health systems, but in practice, it often shifts funding away from community-led and non-medical services. Things like outreach, advocacy, safe spaces, and community-led monitoring are labeled as optional. But we know they are not optional, they are essential. 2 slides down, please, Karen. Without them, systems fail the very people they are meant to serve. And now many of us are looking at the Global Fund's 8th replenishment allocation, GC8, cycle 8, at a time of shrinking development aid. This means fewer dollars, fewer resources, more competition, and increased pressure on countries to justify every single dollar and cent. It also means something very important. Sustainability is no longer an afterthought. Countries are now required to present clear, upfront sustainability plans. Next slide, please. And these plans are being developed right now. This creates both a risk and an opportunity. The risk is that communities are excluded from these discussions and decisions are made without us. And this is why we all have to act now, be involved, be very engaged, and we cannot afford to engage later. We cannot afford to be passive implementers, and we must fundamentally shift our concepts and approach. For too long, advocacy has focused on asking for a piece of the pie, but in today's context, that is no longer enough. We must demand systemic change. We must push for mechanisms like social contracting by governments, fund community organizations. Next slide, please. We must advocate for dedicated budget lines that protect and provide funding for community-led services. And we must ensure that funding reaches not just the national level, but also subnational levels where services are actually delivered. Most importantly, communities and civil society must reposition ourselves. We are not just service providers, but we are political actors and advocates. We are the architects of national responses. And as leaders shaping the national responses and GC8 proposals, we are not just the implementers. So this means engaging much earlier in country processes, building alliances, using data from community-led monitoring, and holding governments accountable. Because sustainability is not just technical, it is political. Next slide, please. And if communities are not at the table shaping these decisions, the systems that emerge will not sustain us. So let me end with this. The decisions that are being made today on GC8, especially for countries that are transitioning in this last cycle or receiving the last allocation this cycle, and the ones that are expected to, and many from our region for GC9, will define the next 3 to 5 years. Not just around funding your services in countries, but funding your entire health landscape in your country. This will decide whether community services and advocacy survive or disappear, whether key populations will be reached or left behind, and whether health systems are equitable or exclusionary. So I will leave you with this very last slide, Karen. Just a reminder that sustainability is political. It is not a technical aspect. And if we do not shake the system, the system will not sustain us. So over back to you, Jimmy.
Thank you so much, Rachel. This is pretty straightforward and strong. But I would also like to bring this time for our participants to see if anyone has any questions for Rachel. We have a time slot for Q&A. Please, anyone, if they want to address anything, any concerns, any questions to Rachel, please raise your hand.
So while people are still looking, I maybe want to raise a couple of things. I think there are some things that are quite real in practical terms. There are some countries in the region that actually have already, I would use the term graduated or transitioned from malaria funding from the Global Fund and are seeing malaria resurgence. So diseases will come and go. It's about ensuring that the systems are community friendly, that there are community systems in place that ensure that we are able to respond to health emergencies, so that if things come back, that the systems do not the systems are able to react to these health emergencies. Because transition is very real in our region, and especially in Eastern Europe and Central Asia, where we have seen that with the diminished and transitioned portfolios, that many of the diseases have came back in larger numbers and without community workers and civil society.
Thank you so much, Rachel. It seems there are no questions right now as we are still building up this webinar. But for next, and we already understood why it is important for communities. So the overview is clear, but now let's deep dive on what is actually happening on the ground. And to do that, I'm handing the virtual microphone to our panel moderator, Karen Lama. Karen, over to you.
Thank you, Chinmay. Hello, everyone. I'm Karen Lama, Communication Coordinator at Asia Pacific Regional Learning Hub. And in this session, we are talking about the regional realities and safeguarding essential service in STC. To begin with, our first speaker will provide a brief overview. This will be followed by live discussion with our community representative from 3 countries, that is Indonesia, Cambodia, and the Philippines. Building directly on Rachel's presentation about shrinking funding space globally and the urgent need for communities to act now, back in 2023, Asia Pacific Learning Network conducted a consultation on sustainable financing for community-led initiative. This work highlighted the significant practical gap between high-level funding policies as well as actual challenges communities face when trying to access local resources. I'm now pleased to invite Avli Khare, Senior Program Officer at the Asia Pacific Transgender Network and a member of the 7 Alliance, to provide us the necessary background. Avli, welcome to the floor.
Thank you so much, Karen. And I know that all of us are excited to hear from our country representatives about what's happening on the ground. So I would not take a lot of time, but just wanted to sort of set the stage by sharing some of the learnings that were captured from a consultation that was hosted by the Asia Pacific Learning Network on sustainable financing on community-led responses. And this consultation occurred in 2023 over several months. And the learnings that I will share are primarily around what are the barriers that different stakeholders sort of identified in exploring different sustainable financing models. Next slide, please, Chinmay. So more broadly, the Asia Pacific Learning Network was basically envisioned as a space and as a platform in which community-led organizations, but also other kinds of stakeholders like technical assistance providers and technical partners, etc., could come together and share their experiences, tools, knowledge around how to scale up and hasten sustainable financing. So the objectives were to ensure that we are able to strengthen South to South collaboration and learning exchanges, that we are able to share what are the challenges that communities are experiencing in exploring sustainable financing options, but also in capturing some successful stories that have emerged from community responses. So this was what the network largely was envisioned to do. And as part to sort of form the network, there were consultations that were conducted. Chinmay, next slide, please. And the stakeholders that were sort of consulted in these consultations were mostly like community-led organizations, technical partners, civil society organizations, funding partners, even academic institutions. Next slide, please. The following are the countries that you see on the screen. So these were where all of the sort of the representatives that were consulted, they were coming from these countries in the region. So we saw representation from Cambodia, India, Indonesia, Kazakhstan, Kyrgyzstan, Nepal, Laos, Papua New Guinea, Philippines, Tajikistan, and Thailand. Next slide, please, Chinmay. So, like I mentioned, this consultation happened across 5 months. There were more than 107 stakeholders that were consulted through key informant interviews, through focus group discussions. And like we saw, there were 11 countries represented in the consultations. So some of the key barriers that were identified were can mostly be categorized across two broad brackets. One is the internal information, knowledge, and capacities of community-led organizations themselves, and the other was more structural barriers external to the organizations that they faced. Chinmay, next slide, please. Okay, so some of these challenges we can see below. Chinmay, you can move to the next slide also. Yeah, and like I said, they were bucketed under these different sort of categorizations. So the one was obviously absence from a regional understanding of what sustainable financing is. That was a barrier. There was a lack of like comprehensive approach to sustainable financing in community-led response. There were lack of information and knowledge amongst community-led organizations on what sustainable financing options existed, and there was limited prioritization of sustainable financing responses in this work. Some of the other capacity related issues were that there was within these organizations weak financial management or resource mobilization related capacities. So, like not dedicated staff in organizations to explore like sustainable financing models, not having enough time or resources to engage with these models, etc. Some of these were internal challenges. Then there were also external challenges, which were more structural and systemic, which related to governance in countries, so related to registration of organizations and how they're able to access sustainable financing models. There were legal policy and regulatory issues, like we see in the example of India, for example, where Indian organizations need to be registered under the FCRA Act to be able to access foreign funding, and a lot of community-led organizations do not have the capacities to be able to get that FCRA registration. But also in the increasing like volatility of political climate, these kind of registrations are also easily cancelable or revoked. So then organizations face like these kind of external challenges in accessing different sustainable financing models. And now I would pass it back to Karen to facilitate a conversation from our communities into what they're doing on the ground. Yeah.
Thank you so much, Avli, for your insight. Your presentation emphasized the necessity of moving beyond viewing sustainability solely as national policy, but also it emphasized the importance of understanding how local efforts safeguard our services, as well as obstacles, like you mentioned, structural, informational barriers, including capacity of the communities and also to register the organization. We must consider this before we begin dialogue or initiative around it. Now I would like to invite Edward, Amanda, and CM to join us for a discussion regarding their respective country landscape. We have Edward Cuisin Camases from Philippines. He is the officer in charge, executive director of Wagawai Equality Incorporation. He has experience working in the SOS Children Village in Philippines, as well as he also has experience working in the private sector. Likewise, we have Amanda Aulia Cindy, work at Indonesia. It's coalition as an advocacy and human rights officer. Lastly, we have a CM Sofal from Cambodia, serving as Phonpan officer at Health Action Coordinating Committee and also a CCM member representing PLHIV in Cambodia. Welcome to you all.
Yes, sure.
Yeah, thank you.
Yes,
Karun.
thank you, Karen.
Yeah, thank you, Karen. Yeah.
Thank you. Edward, let's start with the Philippines. For the participant who are completely new to the community initiative that is happening in the Philippines, can you brief us on what you are establishing and what you have established, as well as what kind of government support you are getting, and also explain how you convince the government to support this initiative? You have 2 minutes.
Yeah, before I start, I'm truly honored to be here with all of you guys. So, um, um, I'm Edward Camasis. I'm the executive director of Wagaywa Equality in the Philippines. Now, thank you for your question, Karun. So, Wagaywa Equality is a community-based organizations in the Philippines located at the Region 4A, which is the Batangas city that was established by the volunteer who recognize the need for the safe, inclusive, and accessible space for our community, for the LGBTQIA plus individuals, particularly those who are underserved and often face barrier for healthcare and social services. We created the Equality Desk, one-stop community support platform where people can access informations, referrals, case management, psychosocial support, HIV-related services, and community-led activities in a safe and empowering environment. One of the key factors in our success has been building strong partnership with the local government unit. We didn't begin by asking for funding. We started by demonstrating that we could help address real community needs. We collected community data, documented services gaps, and presented evidence showing how discrimination, limited access to healthcare, and lack of information affected our community, which is the LGBTI plus individual and other key populations. We then align our initiative with the government existing priorities such as HIV prevention, mental health, youth development, and also for the gender and development. The social inclusion rather than the positioning ourselves as critics, we presented ourselves as partners who could complement government programs and also help reach communities that government services sometimes struggle to engage. Trust was built through consistency, transparency, and also accountability. We regularly shared reports, involved government representatives in community activities, and also maintained open communications. And as they saw positive outcomes and increasing community engagement, more local government offices began supporting our initiative by providing venues, technical assistance, referral, also the policy support and collaborations in implementing the programs, the Equality Desk. Um, our experience has shown that meaningful government partnership is built through evidence, trust, and also shared goals. When communities are organized, solutions are community-led, and everyone works toward. So the same objective of improving people's lives, government becomes a valuable ally in creating sustainable and inclusive program. Yeah, that's all.
It's amazing to see how co-financing can
Yeah.
start with partnership and structurally rather than financially. Amanda, moving to Indonesia, like our initiative has been on setting up local social contracting, right? So could you please enlighten us when you first approached government to fund community services through domestic budget? What were the main arguments you used to get them listen?
Yeah, thank you, Karen, for the question. First of all, I want to introduce that I was work in Indonesia's coalition, and we did the advocacy of co-financing HIV sustainability since 2016, actually. And then we continue our work at 2022 and until now. In 2022, we started from a pilot initiative in 6 cities where communities organization engage local government offices through advocacy meetings, technical assistance, and participation in local planning forums over times. And then we expand to 20 district interventions areas. And then our main argument was when we first approached the government institution, it is not just like technical. I want to state the Rachel Ong that social contracting is political. It's really political. Communities, we have to do the work and then have to gain trusted by formal government services, and then we have to direct the access of the key population because the CSO community service organization is more provided about the data, the understand local realities, and the adaptive effective outreach, referral, and treatment support services. And then we also emphasize that Indonesia already has the legal policies through presidential that the collaboration with civil society organization has been developed by the government itself. So it is called like self mechanism funding, but we divide it into 4 types. And then for the community service organization is type 3 that the government can contract with the CSO, and then we can it is actually like we have a contract with donor. Maybe that's all, Karen.
It's so amazing. So it's all about proving that communities can achieve health results where traditional system falls short, and also felt so amazing to have insight from you, Amanda. Like since 2022, we have been doing this kind of initiative, and self mechanism funding is something new that we want to learn more about it. So okay, jumping over to you, CM. Cambodia is working on domestic public funding to safeguard care for the people living with HIV. What are the real world barriers you are facing when trying to get public health system to fund peer-led care?
Yes, thank you very much, Karen. Also, thank you to Edward and also Amanda that have a good showcase and good strong demonstration about the empowerment of community. Yeah. So even though in Cambodia we still have not yet about the social contract mechanism, but in our country we already have a strong policy, a strong HIV budget. So that we have we have a health equity card for provided to people living with HIV for whole life. It means that every people living with HIV can use that health equity card to access health service everywhere in Cambodia. That is one of amazing that we success. Beside that, we have circular that allow a policy that allow HIV budget to decentralize from the national to the sub-national, so at the commune council or community. Yeah, that is one mechanism. Beside that, we have one more is a circular that we call 007. That is to allow the commune council to hire or to employ the commune that or the community that capable to work in HIV activity. But for the real world, up to now, we not yet have any people living with HIV that can apply or work in that yet, because it's still in the transition to bargain or to negotiate, to explain to the commune council or to the local authority more and more about how important of a community work that cannot that the government cannot work. How community can interact with each other, can find with the community to do HIV testing, to find the community to PL HIV that lost, to follow up back to the service. So we have to explain this more and more again and again to the local authority. So, but I'm still optimistic that we can do that. Because why? Because we already have like we call a policy or mechanism in place. But the real thing right now that we have to do is how to set up the strong mechanism between community and the policy maker to make it happen. Yes, thank you.
Thank you so much, CM, for raising that important component, that continuous sensitization and partnership with the government is very needed to understand them, like communities can be at the forefront. Now that we see what you all are building in your country level, let's talk about the hard realities of keeping government committed. Edward, let's move on to you again. During system integration conversation, how can communities use their daily localized data to make sure that key population space do not get diluted or ignored by local authorities?
Karun, that's a very important question, because one of the biggest concerns during the system integration is that the voices and needs of the key populations can become invisible within large systems. Our approach in Wagayway Equality is to make community-generated data impossible to ignore. Through our equality desk, we document what is happening every day, not just the number of people we serve, but also the barriers they experience, such as stigma, discriminations, delays in accessing HIV services, mental health concerns, and also the gaps in referrals. These localized real-time informations give us evidence that reflect the actual experiences of our community. We also practice community-led monitoring, or the CLM, where community members themselves collect and analyze the data. This shifts the conversations from assumptions to evidence. Instead of saying, we think there's a problem, we can show exactly where the gaps are, how often they occur, and who is being affected. Um, when we engage the local government, we don't simplify present statistical, but we present stories supported by the data. We use the finding to recommend practical solutions that align with existing government priorities, such as improving HIV services, strengthening mental health support, and promoting inclusive healthcare. By framing ourselves as partners who bring valuable community insights, and local authorities are more likely to listen and act. Um, Another key strategy is ensuring that key populations have a seat at the decision-making table. Community representatives should be included in a local health board, technical working groups, and also policy discussions. Data is powerful, but it becomes even more influential when the people behind the data are directly involved in shaping the solutions. Ultimately and lastly, specialized the community spaces should never be viewed as separate from the health system. They are essential partners. Um, they reach people who may not yet trust formal institutions, and the data they generate helps government design services that are more responsive, equitable, and inclusive. By combining the evidence, community leadership, and strong partnership, we can ensure that key population remain visible and that no one left behind. Yeah, that's all, Karun.
Thank you so much, Edward. Definitely using data and our lived experience as our primary shield is non-negotiable. Amanda, you have experienced how fragile government commitment can be when budget gets tight or political priorities shift. So my question to you is, what must communities keep in mind to keep government accountable to their social contracting promises when local priorities changes?
Yeah, thank you for the questions, Karen. So one of the biggest lessons from Indonesia is that political commitment can change very quickly. Budget efficiency measures, leadership transition, and shifting development priorities can easily affect HIV financing. But communities need to institutionalize social contracting within a government system. This means ensuring that HIV community responses are integrated into formal planning and budgeting documents such as local development plans,
Amanda?
annual
Hello,
work plans, and budget allocation. Once commitments are embedded, political priorities shift. Hello? Yeah, can you hear me? Hello?
Yeah,
Okay,
we can
Yeah.
hear
can you
you.
hear me?
Yes, now we can hear you.
Okay, okay.
Okay.
Okay, thank you. So I'm replying. So communities needs to institutionalize social contracting within government systems. This means ensuring that HIV community response are integrated into formal planning and budgeting documents, such as local development plans, annual work plans, and budget allocation. Another important lesson is that accountability requires continuous engagement, not one-time advocacy. Communities need to consistently participate in planning and budgeting discussion, and they also need to monitor implementation, follow budget realization, and document whether commitments are actually delivered.
Mhm.
And communities should also diversify relationship within government. In Indonesia, stronger progress happens when advocacy involves not only health offices, but also planning agencies, social affairs, welfare, women and child protection offices, local parliaments, and even mayoral offices. Finally, communities need to remain united. In many intervention areas in our lesson learned, coalition building and made advocacy more effective. That's from our perspective, Karen.
Thank you so much, Amanda. Certainly, holding them to the paper trail and community to be united is the key. CM, as a CCM representative, looking at the Grand Cycle 8, what explicit accountability rules or language do we need to push to guarantee that domestic co-financing actually reaches community networks on the ground?
Yes, we work hard on this since collect data or information from the ground before we have the country dialogue. And also during the country dialogue, we raise also a key point that must include community into the intervention. So related to co-financing or domestic funding is still on the way. Still on the way that we need to negotiate or to talk more about the intervention, which one, because in Cambodia, like you understand, we are not lucky like Amanda or Edward yet, because even though we have community-led monitoring that work well with the government, work well with the local authority, but the problem is we still not yet bring this to have a buy-in yet from the government. Even though the National Aid Authority already put CLM into the national multi strategic plan to respond to HIV. So I do hope that we will have, like I said, we have optimistic. The government will support us and to fund us along the way with the global fund. So even right now we try to advocate or we the strategic plan or roadmap of our community, which year what we will do, and the second year what we will do, and third year at least we can absorb the fund from the government. That is our plan of a fund path that we do right now. Yes, thank you.
Thank you so much, CM. Before I open the floor to the audience, I want to have a quick one-sentence answer from each of you. So my question would be, what is your single key message to communities navigating this transition conversation happening right now at the country level? Edward, first from you.
Okay, thank you, Karun. My single message is this: don't wait to be invited. Organize, document, and lead. So that transitions can feel uncertain, especially when funding models or health systems are changing. At the Wagayway Equality, we've learned that trust is built through consistency, evidence, and collaborations. When communities come to evolve with solutions, not just problems, and with credible data and the reflex of people's real experiences, government and partners are much more likely to listen and work with us. So our goal is not simply to be included in the system, it is help build a system where no one is left behind. So thank you.
Thank you so much, Edward, for such a punch and strong message that you have just delivered. CM, over to you.
Yes, for me, again, integrate community system into the government and build it more stronger and use CLM as the data proof. So I think if the government or the local authority be familiar with the CLM, I think it will be improved and our work will go along with each other. Just thank you.
Thank you so much, CM. And lastly, Amanda.
Yes, maybe we have to change our perspective about domestic funding. It is not, we are not project implementers, but we are the actors. We are the recognized actors within public system. So we have to show the strong united between our organizations, and the essential are for reaching people, sustain services, and ensuring that no one is left behind in the HIV responses.
Thank you so much, Amanda, Edward, and CM for keeping this conversation so practical and grounded. Now we are open for Q&A session. If you have any question, then please raise your hand or drop your question in the chat box. But please make sure that your question should be short and concise. Anyone? Sharon Gopali, you can go first.
Thank you, Karen, for the opportunity. And thank you all the panelists for the very fruitful discussion. I'm representing CSO, where we are implementing the activities in the grassroots level. So my concern to our respected panelists is that the quality service is critical when we go partnership with the government, public sector, and quality service also equally important to influence the donors. It's not only Global Fund, for any donors. But I would like to learn from you all, the friends, that do you have any experience of importance of this capacity enhancement of the community members and CSO to deliver the quality service, where government can also recognize the importance of community engagement, and where donor can be also the trusted partner to deliver the services for the need people in the community. I thank you all. Over to you, Karen. Thank you so much for the opportunity.
Anyone can answer, CM Edward, Amanda?
Yeah, I can answer that for. Okay, so thank you, Sharon, for your questions. For me, I think for the Wagayway equality here in the Philippines, communities can deliver quality services by investing in continuous capacity building, standardizing service protocols, and also ensuring strong partnership with the local government and health facilities. Like in our experience at Wagayway Equality, we regularly train community volunteers, peer navigators, and equality desk staff on HIV services, case management, human rights, gender sensitivity, and data management, and client confidentiality. We also provide mentoring and supportive supervisions to maintain the service quality. Our experience has shown that when communities are equipped with the right skills, tools, and support, they can deliver accessible, trusted, and high quality services that effectively reach the key populations. Yeah, in the perspective of Wagayway equality. Thank you.
Thank you so
Okay.
much, Edward. Now we have another question
Could,
from Adelaide. So
could,
Adelaide
could I
has
add some?
okay, CM, yes, sorry.
Yeah, could add some. Yeah. Yes, I just want to echo what Edward say. Yeah. In Cambodia, we have experienced good, intervention with PrEP delivery by CSO. If we compare PrEP that delivery by community-led organization, it will be more flexible. It means that even though Sunday or Friday or Saturday, also we can do it. And we can do without a reluctance. We can do by, easy way, like just call wherever we can go. And also even those Saturday or Sunday. That is the good point that our CSO can lead, can support the quality of improvement, especially PrEP delivery. Yes.
Thank you so much, CM. Now, due to the time constraint, we have, I will be going only one question and only one of you will answer it. Okay. So from Adelaide, they are writing that, however, one of the Global Fund's key recommendation is to ensure the meaningful inclusion of young people as a distinct population group. In this regard, I would like to ask whether your work incorporates age disaggregated data and age-sensitive approach. If so, how is this reflected in the proposed intervention implementation framework and monitoring and evaluation system? Anyone? Okay, Edward, you have only 1 minute time, please.
Okay, Karun. So thank you for the questions. Now, yes, at Wagayway Equality here in the Philippines, we collect age disaggregated data or to better understand the needs of young key populations and also identify the service gaps. So this data inform our interventions by ensuring youth-friendly outreach, peer-led engagement, and also tailored referrals. We also involve young people in program planning and implementations, not just as beneficiary, but as a partner. In our monitoring evaluations, we track age-specific indicators to measure service access and outcomes, and also ensuring that young people remain visible and prioritized throughout implementations and the global fund transition process. Yeah.
Thank you so much, Edward, and thank you so much to all our panel for such a grounded and a lively conversation that we had. Now, for the next session, I would like to pass on the virtual mic to Chinmay. Chinmay, over to you.
Thank you so much, Karen. And I guess, first of all, I would like to really applaud the panel. The insights were really helpful. I'm sure it's really helpful to communities, and I could see a lot of appreciation during the panel as well. So with this, welcome back, everyone. And a huge thank you to Karen and the brilliant panelists once again, Avli, Amanda, Edward, and Seum. Hearing those on-ground realities were incredibly insightful. Now, to guide us through the practical considerations for sustainability and transition for the next session, I would like to invite Gonzalo Peñacoba Fernandez, sustainability specialist at the Global Fund. Gonzalo, you have 10 minutes and the floor is yours.
Good
morning.
Are you going to project the slides? Thank you. So yes, so I wanted to go through some of the slides that you may have already seen, since I understand that the official guidance around sustainability, transition, and co-financing has already been presented by my colleagues from the Health Financing Department in past sessions with the Learning Hub. So the reason, the point is not to repeat what has already been presented, but to provide a bit of a different reading. So to start, the message that the new Global Fund strategy and what are called the strategic shifts focus on mobilizing increased resources, be it from other partners like the World Bank or from domestic resources, is another way of acknowledging that the Global Fund resources are diminishing sharply. If we go to the next slide, that is about the strategic shifts. The fact that now the transition dates are firm and it makes it predictable and allows for concrete planning. But it also means that there is no more room for maneuver. Also, all the exercise around prioritization, it also has a reverse of the coin implication, which is that certain investment areas will not be financed by the Global Fund. Can we go to the next slide? At the same time, well, even then the following one, please. Yes. In this new context, there is a new focus on implementing the Global Fund co-financing policy as an essential lever that affects how the transitions happen. If we move to the following slide, the push is on discussing the co-financing commitments and the submission of the co-financing commitment letters early, so that what is in the co-financing commitment is coherent and is complementary to what is being funded in the Global Fund grants. So the idea is that the conversation about what goes into the Global Fund grants happens at the same time as the conversation about what should be covered through the domestic resources in the co-financing commitments discussion. So this is also reflected in this slide in the insistence on the requirement for what is called, the one that is in the middle, the number 2, specific programmatic commitments, meaning not just total amounts of domestic resources in disease spending, like health sector staff salaries or operational cost of facilities, but on increasing the proportion of the public financing on key interventions that now, today, are too reliant on donor funding. And that's why this graph shows a different set of requirements on the right side of the slide for the countries that are closer to transition than the requirements that are asked on the left side of the slide. In practice, with some exceptions, most of the countries in the Asia region fall in this category these two categories on the right-hand side of the slide. If we can move to the following slide, please. So the reason to underline this is that although it is true that the situation is challenging because the donor funding is going to be completely phased out in the near future, which in past year was more of a theoretical factor to take into account, and now it's a hard reality. It is true that the Global Fund is not going to withdraw abruptly. So my point is that it is fundamental to use these last cycles where there will still be Global Fund funding as an opportunity rather than as an inescapable doom. I mean, the worst possible approach for these few cycles that are left will be to continue implementing as many activities as possible with the funding that we have, and then hope for the best in terms of the government or other donors picking up the tab when the global funding stops. So what it means to use this as an opportunity is, for example, the fact that these co-financing requirements by the Global Fund exist should be leveraged to make sure that domestic funding is allocated for the community-based interventions, which are one of the interventions that are funded by the Global Fund that typically are the most reliant proportionally on external resources. So the idea would be to make sure that the in these cycles that are left, the Global Fund co-financing requirements are used to start getting domestic resources into these community-based interventions. Some of them are today still at 100% reliant on the external funding. I understand that there is a tension or a temptation to, during the country dialogue, to always try to secure some funding from the allocation for these interventions because it's felt like a sure bet, while the domestic resources are more of a complication. But I think we have to acknowledge and fight that tension of trying to get all the funding for the community interventions inside the allocation. We have the opportunity now to ensure that the co-financing requirements are leveraged to make sure that domestic resources also go into these interventions while there is still global fund funding. Can we go to the following slide? One more, please. So it is important to be aware that when the conversations about what should be covered by the co-financing commitments take place, there will be competition with other programmatic priorities that are also depending on global fund funding and that need also to be shifted to government resources, like, for example, the procurement of health products, the diagnostics, etc. So in these conversations that happen during the country dialogue, these are very complex negotiations that involve also a wide variety of stakeholders with very different agendas. And in that sense, I think that anchoring the discussion in the country's explicit disease strategy or the national strategic plan may be a robust way of referring to or finding a common ground and not just focus on what is funded by the Global Fund, but look at the whole picture of the need. So what it means is to look at the whole need on one side and the different potential sources of funding on the other, and then make choices. So, for example, in the case of if the country, for example, has loans from development banks, strategically, it may make more sense to use those loans as a source of funding to act as a bridge for the procurement of drugs and health products until they can also be absorbed by domestic budgets. Or maybe look at existing procurement, pool procurement mechanism that may already be operating in the country. Like, for example, for vaccines, these things are already working. And so what kind of fiscal space there is there? So, and this, I mean, as you're going to be involved in these conversations during the country dialogue, and you're going to see that tension of other priorities also trying to get into the co-financing commitments. So why would it, one of the arguments is of why would it make sense to prioritize shifting first the community-based interventions into domestic financing instead of the procurement of commodities, for example? So because, as you know very well, these interventions tend to be implemented through the community-based interventions tend to be implemented through very parallel systems, and the current financing flow cannot be just absorbed under the government financing. So thinking of shifting early also implies setting up the structures for these services to be financed and implemented in a sustainable way. We go to the last slide. So another thing is that when we go into these discussions around the setting up of the mechanisms for financing of the community-based interventions and their implementation structures, from the experience that we have had, there are several points that I would like to put on the table for your consideration. So the main point is that looking at things from the point of view of governments, the point is not to finance CBO activities. They are not going to finance the activities of the CBOs. What they're going to finance is the service delivered to the population. So whatever the activities are carried out, they are just a means to an end, which is the services reaching the beneficiaries. This is important because any discussion about financing of community-based interventions, therefore, has to start with the package of services that is to be delivered to the beneficiaries, not with the list of activities that the CBOs implement today. These activities, I mean, we are supportive and we are convinced of the value of these interventions, but this should not be the point. The point should not be for the communities to continue doing what they are doing today, even if what they are doing today is of great value. The perspective of the government is going to be what is the outcome that these activities are generating. So the same, any discussion about costing must be framed in terms of what it costs to deliver a specific set of service to a specific set of beneficiaries, not with what are the costs of operating and conducting activities for community-based, community-led, and in general CSOs. This can also acknowledge the fact that the cost of delivering the service is not the same for the first 90% of the target population and the last 10%, which is much harder to reach. But this can be built into the costing, but it has to be from the point of view of delivering a service, costing for delivering a service, not for an organization to operate. And that's, and this, I hope that you take it as a friendly criticism, but the presentation of Avli highlighted the barriers that the organizations face for accessing funding. It should not be seen from that perspective. It should be seen from the perspective of the barriers that exist in country for a certain service to be delivered to the population. I mean, the government should feel responsible that a certain population receives a certain service. And for the moment, that there is no structure to do that. There is no structure for the country to finance it, there is no structure for the country to deliver it. But the perspective, even like the advocacy point, should not be that the community organizations face barrier to access funding. It should be that there are barriers in the country for those services to be delivered to the population. Another thing around how we have framed the discussions in the past, there has been a lot of focus and a lot of TA being provided on figuring out the contracting mechanisms that allow the government to pay for activities delivered by CBOs. This approach many times sidesteps the difficult question of what does the government consider worth funding. A typical discussion about what is called social contracting would be carried out many times without government representatives in the room, with only CSO representatives. So the discussion would naturally drift towards focusing on how to make sure the different functions of the CSO could be financed and how the CSO had to set up themselves to be contracted, etc. Again, we think that it's important to also take into account the vision of the government. When we raise the situation in Indonesia about budgetary constraints, for example, that are hindering the progress on the social contracting pilots, it makes sense to look at the investment in community-based services in terms of infections averted through prevention interventions, or in terms of tests provided and case detected and linked to treatment, or in reductions to follow-up. Because like this, we are making the case of what is the return on investment of that intervention. So it links to the budgetary considerations that the government is thinking of. It's like, if we don't put this money on this, what is the cost that we're going to have on the longer term? And this takes me to the last point, for which I have to confess that there are no real solutions, no silver bullets, is the question of the capacity building of the CBOs and their advocacy role as well. These are difficult questions to address in the context of transition away from donor funding, and there is no real solution or no good solution that works always. As part of the set of recommendations from the work around social contracting, it was very typical to have points around capacity building to implement services, as well as to conduct better advocacy for the role that the community-based organizations perform. It's not very realistic to expect governments to fund capacity buildings of CSOs to bid for contracts, or the government to fund advocacy so that the governments would allocate resources for social contracting. The government would be funding organizations to advocate against them. So the avenue that has more chances of success is probably ensuring that the space is created for communities to be part of the design of the service package, or that there is also public oversight mechanisms for accountability on the allocation and use of resources. But these don't need to be like key population specific or even disease specific. That can be like public accountability mechanisms for the whole public sector financing. And also that as our colleague from the Philippines was insisting on the use of data, make sure that decision makers use and promote mechanisms like community-led monitoring to improve the quality of services as part of their normal way of operating, to ensure that a service is delivered with the best possible quality. So these were the points that I wanted to make from a practical perspective as we go towards the sessions on country dialogue in the ramping up to GC8. And I'm sure that is not an easy conversation.
That's it. Next slide. Thank you so much, Gonzalo. We really appreciate your practical considerations and bringing forward your points. Um, so for next, I would like to quickly ask participants as well as panelists if you have any questions for Gonzalo. I'll request you to raise your hand, anyone, if there are any questions for Gonzalo. Yes, you.
Yes, thank you very much, Gonzalo. Yeah, it really appreciates with your slide presentation, also strong forward to community. So for me, as a person who implemented the community system strengthening and also community-led monitoring, so how can we ensure that the budget from the global fund will more focus to the community system or community-led intervention? Because like you understand, in the context of country ownership, they will have more activity or more priority than that. So how to ensure that the fund from the global fund can more deliver to a community-led intervention or community-led monitoring? Yes, thank you.
Thanks.
Thank you.
So this is what I was trying to convey before, that we also have to look beyond the current cycle, in the sense that if we ensure that global fund funding goes to community-led interventions today, what is the plan for in 3 years from now? It's like, if we continue doing this and we ensure that the funding from the global fund goes to these interventions, we are still postponing the problem, which is when the global fund funding is not going to be there, which now is going to be in 3 years from now or in 6 years in the best case scenario. So my whole point is that we have to ensure that during these 3 years or the 6 years that we're going to have for some of the countries, we make sure that we use this time not to depend on the global fund funding anymore, and to shift that dependency from the global fund funding to the domestic resources, and use the global fund funding as really, I don't want to use this word because it's so overused, but catalytic, in the sense that we use the global fund funding to help set up the national structures on how the system should work in the future. When there is no global fund funding, we have to have a vision of how that is going to work. And that cannot happen from one day to the other. So it will take time and it will take investment into shifting those national systems. So let's use the global fund funding for that change, not to continue funding the services.
Thank you so much, Gonzalo. Gonzalo, we also have one more question in the chat box. What is Global Fund specifically doing in GC8 to strengthen and expand co-financing commitments? And what is the role of communities in this work?
So financing commitments is something that has always existed at the Global Fund. Countries were supposed to increase their expenditure in the disease response cycle after cycle. These financing commitments always work with a formula in which the country on the current cycle is supposed to invest in the disease response the same that it had invested in the past cycle, plus a certain amount. That certain amount is usually calculated based on how much is the global fund allocation. But the whole idea is anyway that the country's investment always increases cycle after cycle. Now, what we are insisting in this new phase is that it's not just about total disease expenditure, because in total disease expenditure, countries that have a tendency to include all the salaries, all the operational costs, and the risks are really in certain interventions, and in particular for the audience of this workshop, key population interventions are one of the examples, but there are several interventions that are funded by the Global Fund that tend to be really, really reliant on external resources to the level of 100% or 90%. And so the whole point is to ensure that the co-financing commitments by the government focus on those interventions that today are very reliant on external resources, because those ones are the most at risk of when transition comes. So the co-financing requirements now are narrowing into saying, no, it's not just about total disease expenditures, it's also about the country investing domestic resources, public resources, in those specific interventions that today are fully reliant on external funding. And key population interventions are a clear example of those.
Thank you so much, Gonzalo. I also have one question from my side. As we are talking about putting communities forward, right? So my question to you is how is Global Fund planning to keep governments accountable, and how can communities also learn and make sure that this STC policy is supporting this, as well as how can communities engage during this whole process?
Mhm. So the co-financing requirements, the co-financing policy checks that the governments regularly invest what they have committed to invest. And there is a policy decision that if the government doesn't fulfill their co-financing commitments at the end of the cycle, the following allocation could be reduced to the country. And it could be reduced at a level of twice what the government co-financing was missed. So if the government co-financing was supposed to be 10 million on something, the Global Fund allocation could be reduced on 20 million. So it's a very tough situation that nobody in the Global Fund wants to arrive to, but is what the policy says. And so that is usually the mechanism of accountability, saying the Global Fund allocation should only be a complement to the country's investment in the disease response. It cannot be the core of the disease response. So the Global Fund allocation has to only be like the top up to what the country is already doing in the disease response. In terms of the communities being involved, the normal mechanism is always the CCM for the oversight. So CCMs have an oversight committee, usually within the CCM, and that's the way of verifying that also during the implementation period, these commitments are being fulfilled. But today, the real place to be involved is in the country dialogue, and the communities should arrive to the country dialogue more than with a list of demands or things that are needed, more in a negotiating attitude, because there are going to be trade-offs to be made. And so I think it's important to prioritize what is important and to already in advance of the country dialogue, maybe negotiate with some of the stakeholders what can go in from each one of the stakeholders and what certain stakeholders are ready to let go. I think it's more of a negotiation than just a list of needs that then will not be prioritized appropriately.
Thank you so much, Gonzalo. For responding to all the questions. Looking at the time, I will request everyone to quickly turn on their cameras so that we can have a group photo, and of course for the reporting purpose as well. And after that, we will try to wrap up on time. Requesting everyone to please turn on your cameras quickly. ले लेना तो ही तू बोल. Wait. Okay, 1, 2, 3. Smile, please. One more. 1, 2, 3. Thank you so much. Yes. So now, as we are nearing the end of our webinar, we have heard what is important for communities. We have explored what regional case studies and countries are at right now, and we have also unpacked the practical considerations from Global Fund. The final puzzle piece is how do we operationalize this, as well as how do we ensure community non-negotiables are actually captured during country dialogue. To answer that, I would like to welcome John Beku from Anglophone Africa Regional Learning Hub by ENASO. John, I will request you to quickly introduce yourself, and the floor is yours. But please,
Thank
just
you.
7 minutes.
Yes, thank you, Shimli. Thank you so much, colleagues, for this opportunity. I'm stepping in on behalf of Lisa, my colleague, who is doing another presentation currently. Now, very quickly, for us as an Anglophone Africa Learning Hub, we support the Anglophone countries Africa for communities to effectively engage in global fund processes at national and at regional level. One of the mandate that we've done, and one of the activities that we've done that is critical to this subject is we supported the development of a community guide on STC. The main objective of that is to ensure at least community can also engage, can participate in STC processes. Communities have voice can be heard, communities' proposals can be heard, and communities can play a critical role in designing transitions plans, sustainability mechanisms, and also push the government for co-financing. So that guide is available for communities to use. It is a step-by-step guide process that at least communities can be able to use and apply. Yes, Chimney, maybe the next session, the slide. Yes, so the next slide, please. In the interest of time, I'll just go. I want to go straight to the guide. For us, the guide has provided a good description and definition of STC. And as you can see there, yes, next, please. Yes, yeah. So the main objective is that I think we've realized there's a gap in community engagement in transition, sustainability, and co-financing. Communities have been very active in designing programs, global fund programs, implementing global fund programs. But when it comes to sustainability and transitioning from global fund support and the co-financing responsibilities and expectations of governments, communities have not been paid a very critical role. And so there was a knowledge gap there that has impacted that knowledge. Then also when we have seen with experience when the transitioning is happening and the government is taking up the roles and responsibility, most community interventions are left out, are dropped out, especially those the interventions that support key populations and other community responses. They always end up being lost. We also wanted to ensure that the community voice is heard in this transition process. At least they can be participate and can join the table in terms of designing those transition plan and also implementing them. There have been communities have been advocating for increased resources, but we also wanted to scale up that scope to ensure at least there's accountability on even on the domestic resources that are allocated to health programs. Next slide. So the key feature of this guide that we have managed to put to place, it has a STC glossary, that is a definition of key terminologies. The reason why we thought this is important is to ensure that at least we have a common understanding of what we mean or what the global fund means, or what country mean, or what communities mean when we talk about STC. So to have that common understanding and common operational point of view, so at least we should be able, we can move towards the same direction when we talk about sustainability, transition, and co-financing. The other feature in this too, we'll have the 10 steps community action framework, how to engage in STC and how to do STC. The other part is GC8 module mapping. Now, once communities understand and they are able to engage in STC, it was important for us to guide them in the Global Fund Modular Framework, what is available or what can be accommodated in terms of STC within the Global Fund Framework. If communities ask for interventions and specific activities within the GC8 that can support STC processes? For example, can communities ask for generation and development of transitional plans? If they can ask that, then we will sure they can push the governments to be able to develop some of these transition plans. Co-financing requirements, meeting them. How can the communities include activities that can be able to support them to push governments to meet the co-financing requirements? Real country examples, the tool also provide that, examples of where transition has happened. Sustainability is also has happened, and also co-financing has worked well, and also includes case studies where things have not happened very well. For example, when you transition and then you find specific community interventions that are dropped out by governments, especially key and vulnerable populations interventions. So we've provided those examples, and we've seen countries where they have gone back to global fund financing because of some of those gaps within the STC processes. The tool also includes accountability tools and key questions that communities might ask, and also indicators that show the STC is actually happening. Next slide, please. Yes, so how can communities engage? That is a big question now that we have this. So the tool also gives guidance on how communities can engage. For example, in country dialogue, during the country dialogue, these things can be highlighted by communities when they participate in country dialogue for GC8. They can bring out the interventions, the priorities that they need to put under STC, and which modules are covered within the Global Fund framework, and which interventions that they can ask for in terms of financing STC activities. So at country dialogue process, communities can pick it up and implement. Then during grant writing is to ensure that at least we have the STC interventions have been covered to support the development of the STV interventions and activities within the Global Fund. They can sit in within the writing. Once they have those specific activities that they've identified, it's easier during the writing to bring them up and advocate for them to ensure that they're included. Then oversight and accountability during implementation. We know there are many transition plans that have been developed across countries that we work in, but the implementation of those transition plans have been very weak. So the communities can put interventions or activities during implementation to ensure at least the community interventions are effectively implemented. Now, the most important part was for us to ensure communities can actually engage and participate in the STC. That is number one. Number two, to ensure they have funded interventions within GC8 that can lead towards STC. And this is very well connected with issues around social contracting as a mechanism when there's transitioning. How can government put together the policy framework to allow for communities to implement activities on behalf of governments and can be contracted by governments? And in our region, most governments don't have the legal environment, but these are some of the things that they can put in the GC8 to ensure that legal environment is created and the capacity of civil society organizations is created to be able to be contracted to implement interventions, community-led interventions on behalf of government. Next slide, please. Then we also, in the tool, we also looked at success stories. So it is included. We have a number of countries where this kind of transition has happened. We have case studies: China, Costa Rica, North Macedonia, and Malaysia. We've picked some of these success stories that where transition has happened effectively and very well. So at least it provides examples on where things have worked, what did they do, the lessons learned from those processes, and what were the success factors that made these things work within these countries. Next slide, please.
John, 30 seconds.
Yes, so I think this is the last one, should be the last one. So the role of STCs, we agree starts now. We need to be able to design the STC interventions within GC8, implement the STC interventions, and also ensure it's implemented effectively. So we have the guide that can be downloaded, and we can also share with the network to see how that guide supports communities to engage. We need to identify which services in our context that are most at risk. That is a very important part of the step-by-step process, because not all services are at risk. We know most countries will prioritize treatment, but other community interventions may not be prioritized. So we need to conduct that mapping exercise and assessment to ensure which interventions are most at risk during transitions. We need to also engage CCMs very early to highlight that the fact that transition will come and it will happen, but how do we engage to ensure that at least community interventions that support the response to the 3 epidemics are protected. Then we can also use the Annex 2 to advocate for STC interventions in GC8 funding request and monitor government co-financing commitments. We know right now countries are developing their commitment letters. Can we compare that with GC7 commitment letters? And when we move forward to GC8, what are these commitments that are put in and can they be able to be implemented? And we monitor that to support to ensure fully implementation. Yes, Chimney next. I think this will be the last slide.
Thank you so much, John. Yeah, thank you so much for your presentation, John. We had some time for questions, but now as we don't have much time, I will request you to participants, if there are any questions, please reach out to us through email, or you can also reach out to us through WhatsApp groups, as we already have shared our WhatsApp numbers to everyone. One quick comment, like, if you want to know more about GC8, we also have an initiative called Podcast Initiative, where we have released 6 episodes till now. Those are like small 8 minutes episode and quick guide to different topics like HIV, TB, malaria, RSSH related topics. And like, we will have one more podcast episode which will be released very soon. So please use this link, reach out to our YouTube page and kindly have a look. For our last closing, first of all, as a moderator, I would like to thank all the participants, all the speakers and speakers to share their insights. But to formally close our session today, it is my pleasure to invite Numan Afifi, Program and Advocacy Lead at APCOM, and the member of Seven Alliance Consortium, to deliver a closing remarks. Numan, over to you.
Thanks, Chimai. Thank you, everyone. So, listening in to today's conversation, I think it's very clear that sustainability has become, one of the most frequently used word in global health at the moment, but perhaps the most least agreed upon. So, like for Ministry of Finance, for them, sustainability means like reducing dependence on external funding. For donors or global fund, it means like countries taking greater ownership. But for communities like us, I think what we meant by sustainability is something much simpler. We ask whether people will be able to access services that they rely on 5 years from now, 3 years from now. Those are not always the same conversation. So as we move into GC8, I think we need to challenge one assumption. That is, if we increase domestic financing, it automatically leads to sustainable programs. Of course, money alone does not guarantee sustainability. So governments can allocate a budget, but it will mean that some community-led organization will disappear. Services can be integrated into primary healthcare, but it will probably means key population quietly stop accessing those services. So on paper, maybe program can continue, but trust has lost in practice. So perhaps the question for GC8 is not simply asking whether how much domestic financing will be there, but I think it will be interesting to ask also what exactly here that we are trying to sustain. So if our answer is about healthier communities, then we need to sustain more than just medicines and clinic. We need to sustain peer navigators, community-led monitoring, legal support, the trusted outreach workers, spaces, and organizations that have decades, doing all this good work, reaching out of people, which public system often miss. So I also think that as we heard from Indonesia, from the Philippines and Cambodia in the discussion today, there's no blueprint for Asia and Pacific. Every country has to find its own pathway, but that also means that we cannot wait for a perfect model before engaging in STC. So we should shape that model while it's being built. So as country begins their GCI dialogue over the coming months, is our hope at Seven Alliance that all of us communities enter those conversation, not simply asking for funding, for money, but ask better questions. What are we trying to sustain? Who benefit? Who bears the risk? How we will know whether transition has actually succeeded? So those questions are important as the numbers. So thank you, everyone. Thank you, Chinmay. Thank you, all speakers. Thank you, Global Fund Advocates Network, Asia, Regional Hub, everyone who joined us today.
Thank you.
Yeah, I hope we can see again. All the best for GCI process.
Thank you so much, everyone. Thank you,
Thank
Numan.
you.
Thank you so much, everyone, for
Thank you. Thank you
participating.
very much.
Thank you. Yeah,
Bye.
thank you very much.
Bye.
Yeah, bye-bye.
Thank you.
Bye. Thank you.